So my name is Shivam Agrawal, happy to be called Shiv. I work as a specialist in the hospital as a clinical and laboratory haematologist. So that means I treat patients on the wards and in the clinics, but also have a role in the laboratory with diagnostics and quality assurance. And then I'm also currently in the role of clinical superintendent in medicine at Prince of Wales Hospital, and that role primarily involves overseeing the training and supervision of specialists in training in internal medicine, which I quite enjoy. Yeah, so in my current role, I started here in January of this year, but I've been at Prince of Wales on and off for the last 16 years. I trained here at UNSW and was at Prince of Wales for most of my student placements, and then I did most of my training both in internal medicine and in haematology at Prince of Wales over the last 8 years or so, with a little bit of time away. And just recently I've been in Melbourne for the last couple of years at the Olivia Newton-John Cancer Research Centre doing a fellowship there, and so just came back this year. But yeah, I've been in and around the campus for a long time, but just in my current role, just back this year. Yeah, so I think that's a good question. I think I've worked in a lot of different hospitals, and the one thing that I think stands out at Prince of Wales is the collegiality. I think everyone, all staff in this hospital, but also in the neighbouring campuses, all have a very similar goal of looking after patients and making sure the patient experience is as good as possible. And I really value that as a staff member, but I also think it's quite good for, it's excellent for patients. And as I've become more senior, had to liaise a lot with Sydney Children's Hospital and Royal Women's Hospital and the university, and I think every site on this big campus really has the same goal, and I really enjoy working in that type of environment. I really enjoy the puzzle of medicine and solving problems, and in haematology especially, we have lots of lab tests, and our patients and their problems are usually very complicated, and it's really exciting to try and solve the problem primarily. So that's what really drew me into medicine in the first place, is problem solving, and then drew me into haematology. But then further to that, I really like building long-term relationships with patients. A lot of our patients stay with us for a very long time, and following them through and see them improve. Different roles every day is sort of very different, which I really enjoy. I really like the variety in my work, but a typical day could vary from being in the clinic, seeing patients, and then going to the ward to see patients. Luckily, we have a very nice new acute services building where our haematology ward is located on now, which is excellent for all involved. So that might be what a clinical day looks like. A laboratory day will be looking at blood films and other reports to sign off in the laboratory. And then if it's an education-based day, it'll be supervising or taking an education session for the trainees, or being in some sort of committee meeting. So every day is very different, but all very enjoyable. I think one of the main challenges for me at the moment is just getting to know everyone, because I work with so many different people, and I have been away for a couple of years. So especially with my education role, there's a lot of new people that I'm working with, and I really value building relationships with everyone I work with. So just getting to know everyone, remember everyone's names, learn a little thing about everyone I work with. Yeah, so I don't have, there's many patient experiences that I'm very fond of, but one that comes to mind is treating a very unwell person in the intensive care unit, and then we went to the laboratory and looked at their blood film, which sort of helped us sort of put all the pieces together and make the diagnosis of a very serious but very treatable condition. And then we initiated the treatment. The patient was in intensive care for another few days, but made a very good recovery. And then I remember seeing the patient a few weeks later in the clinic. They're back at work, very happy, back to their normal life. And I think that's a part of medicine and a patient, recurring patient memory that I really enjoy, seeing them, very ill, and coming through the end of it and getting back to their normal life, doing the things they enjoy. And I really enjoy that part of medicine. Absolutely. So I'm an avid runner. So running is really good for clearing my mind, but then also just to keep fit. Currently training for a half marathon, which I'll try to do next year, which will be good. So that's really my main sort of regular activity. I also play quite a lot of squash, which is quite good, and then I'm a big sports fan, so I like to watch the AFL in the winter time and the cricket in the summer.